Welcome to Med Talk. Well, today we have a very interesting topic to talk about. With me, I have Fatima Robilliard that will help us to understand more about contraceptive pills. Well, first of all, how are you doing today, Fatima?
I'm doing great. Thank you for asking. What about you?
Also great to hear. Well, what do you think if we started with this podcast?
Perfect. Let's go.
Okay. Well, one of the questions I prepared for today, um, talks about the side effects of contraceptive pills and how they can be managed. So, could you please answer these questions for the people?
Of course. Contraceptive pills, also known as the pill, are oral medications that usually contain hormones. A combination usually of estrogen and progestin, used to prevent pregnancy. They work by suppressing ovulation, thinning the uterine lining, and thickening cervical mucus. All of this so the sperm cannot reach the egg.
Okay, and do you know some like side effects people can experience while taking these pills?
Yes, there are a lot of side effects. The most common ones include nausea, breast tenderness, and um, irregulation in the menstrual cycle. All of these side effects, though, can only last for about 3 months, and if you take the pill correctly, they will be gone by usually the first 3 or 4 months that you take it. Though if they are very severe, like if the pains are really severe, you have a lot of headaches, or you start bleeding a lot during your menstrual cycle, it is important that you let this know to your doctor or a healthcare professional.
Okay, so if you take contraceptive pills, you have like two options with the side effects, right? So they can be temporary or like 2 3 months, I think you said, or you can happen to have like a lot of stronger side effects. So you may need to talk to a doctor, right?
Yes, exactly. There are also some side effects that are more emotional. Like some women,
Right.
while taking the contraceptive pill, tend to be a lot more emotional and sensitive to everything. In that case, there's nothing you can do to prevent it or to like make it go away. You just need your partner or the people that surround you need to be very patient, and the person taking the pill, the woman that is taking the pill, also needs to understand that she is very emotional at the moment and that some things she may feel like are a big deal when they are not. So it is just communication between the woman that is taking the pill and everyone surrounding her.
Okay, so we could have like physical side effects and emotional side effects, right?
Yes,
Um,
exactly.
but
As
uh,
for the physical side effects, if you want to know how to like prevent it, or maybe not prevent them or make them go away, but to make them maybe less painful or less um
less severe, like
less exactly less severe, and like you can get them like 1 or 2 days a week instead of every single day of the week.
okay,
um for example, to manage nausea, which is one of the most common ones, taking the pills, for example, with food in your stomach, like after eating or at bedtime, can be very helpful. About breast tenderness, wearing a supportive bra and applying some can be warm or cold compresses may also provide relief.
okay,
And the changes in the menstrual bleeding patterns, like spotting or breakthrough bleeding, can be managed by giving the body just time to adjust. However, this is abnormal bleeding is one of the most common changes when something it's not going right. So if you feel like it is a lot different than it is normally, it is better that you contact your doctor and talk about it just so you know it is okay.
Right. So, well, I think in every case, we can um, like it's like if I had to take contraceptive pills, I would
I hope
prefer
not.
also to. um, I hope I think the first thing I would do is like contact a doctor or like I don't know, get help from a professional, so they could make me feel a lot more comfortable and give me a professional point of view. Like I don't
Yes,
know.
exactly.
Okay.
Though normally when someone is taking the contraceptive pill, they do have appointments with their doctors uh regularly, just so like their doctor can see how their body is doing and how they are reacting to the pill. Because sometimes there are women that their body just cannot stand the pill, or they feel very depressed or they feel bad while taking the pill, and they would prefer not to and use other contraceptive methods also. So that is just, you start the pill and you see how your body is doing, and then you contact your doctor if anything goes wrong.
Okay.
There are
Well,
also types of contraceptive pills, so maybe if one isn't working, another one can't.
right. So there's like a type for every different body. Like okay. Well, continuing with the questions we have prepared for you. The next question is talks about the effectiveness of the pills, and it says are contraceptive pills 100% effective in preventing pregnancy, and what factors can affect their efficacy?
So no contraceptive method, anything, including contraceptive pills, can provide 100% effectiveness. That is just not, it just can't. You can't. They are um very effective. They have a failure rate of less than 1% when used correctly. There are still factors that can reduce their effectiveness. So, um, for example, consistency. If you take the pill with consistency at a certain time every day, for example, if you take it every day at 10 p.m., it is less likely that you get pregnant than if you take it at sometimes in the morning, sometimes in lunch, sometimes at night, because your body doesn't have like this constant and repetitive cycle of you taking the pill, so it can just like confuse itself, and it is a little bit more possible that you can get pregnant. Also
So you said
certain,
if you have like a schedule to take the pill, it's better for the effectiveness.
exactly, you need to take it like at a certain hour every day.
Okay.
uh
Okay. Perfect.
Certain medications also can interfere with the effectiveness of the pill, like for example some antibiotics, anti-epileptic drugs, or antifungal medications. They can interact with the hormones inside the pill, therefore they reduce their efficacy. So it is important to consult, of course, with your doctor before starting to take the pills, because if you suffer from, for example, epilepsy, and your pills for the epilepsy are not like compatible with the contraceptive pill, um, your body just it probably will not take the pill, right? And your doctor will tell you if it is better that you get another type of pill, or if you just avoid contraceptive pills and just look for another method.
Well,
Uh,
I just have to I have like created this question right now. I'm curious about it. So what will happen if like you combine two anti well how would I say it? Like two anti con conceptive methods. I don't know if it's well said. For example, like combining preservatives with the contraceptive pills. Uh, does this will like increase the effective percentage?
so it would not like raise the effectiveness of the pill per se, but if the sperm cannot reach, the egg, because of the preservative or the condom, it is like the pill will not work because the sperm, it's not like inside. But let's say the preservative did not work, the pill can and probably will prevent pregnancy. So if you use like double methods, it's great because it is like double protection.
Okay. Well, let's continue with the last question of this of today's episode. That is, what are the different types of contraceptive pills available, and how do they work to prevent pregnancy?
So there are a lot of types of contraceptive pills, but there are three main ones. Um, the first one is a combination of um, progestin and um, estrogen pills, are the most common ones, the ones that usually people use. They have
Okay.
this combination of two types of hormones, and they, as I said before, they serve to um, thin the uterine lining, thickening cervical mucus, and making it difficult for the sperm to reach the egg. There
Okay,
is
so
another type.
that's like the first one is like the basic one, like the most common one,
Yeah,
right?
the most common one. Like if you
Okay.
want to try contraceptive pills and you have like a normal body, it's the one that you are going to be prescribed, and then you will see how your body, um if your body like rejects it or if it is okay or how it reacts to it.
Wait,
There are
with a normal body, the well, you said if you have a normal body, we're talking about like if you don't have like allergic reactions to these hormones, right? Like something like that, right?
Yeah, not exactly like allergic reactions, but if you like not take any like outside pill for anything, or if you don't suffer from any type of, like, for example, high blood pressure or sometimes
Okay.
cancer or different things, it
So
can affect it.
so if you're like healthy and don't have like and any like health problems, you can take the normal one, right? Like you don't have to get it prescribed by a doctor or like have to take like a special contraceptive pill.
It is better that you get checked by a doctor, even if you don't have any type of like physical problems or anything. It is recommendable that you turn to a doctor first, because you never know. You never know. So
Okay.
it is best if you get it prescribed first, but it usually, nothing will happen. Just go to your doctor, please.
Okay.
there are
Well, please continue
there's another
explaining the
type.
types.
Yes, there's another type that is progestin only pills. Also, I think they're also called like the mini pill.
Okay.
Um, which normally they have like the same effect, though it is a little bit more likely to get pregnant because there are some things that like don't work as much as the pill that contains estrogen too, like the normal one.
Okay, so
And
it's like
the last one is the one that contains estrogen. So basically, it's one that has both, one that has only estrogen, and one that has only progestin.
okay. So um so like it's more simple than you could think because there's like it's always the same two hormones. Like you can get it both of them combined or like separated. So I think it's very interesting. So to know that.
Yeah, yeah. I am here just to, just for that, share my knowledge with the world.
Yeah. Well, your knowledge is very valuable, and thanks for answering today's questions.
Thank you for inviting
So
me.
no, it's all my pleasure. Well, that is for today. That's it for today episode. I hope you like it, and well, stay tuned for next episode. See ya.